Hello, welcome to It's Beauty Binge. We are so excited. Today we are talking all things vaginal health and about ED and sexual wellness. So we're really excited. This is a subject that does not get discussed a lot. As you know from previous videos, we really like to talk about things that we believe need to be discussed more. So do you want to introduce who we have here? And then we're going to get into it.
We have Kim, who is the clinic director, and Katie, who is the medical director. Do you guys want to tell us a little bit more about what you do here?
Katie is our medical director, and I just run all of the rest of it.
That's awesome.
As far as the staff and the sales and the marketing. And
we're a medical spa. And so rather than just doing only beauty, we also look at medical reasons to elevate and make you your best self, which does include anything from skincare. But beyond that, we also work on hormone health and sexual health, as we will discuss today.
Yes.
I'm excited. I feel like I'm going to learn so much today.
I think we're all going to learn a lot. So everyone get ready because also we're only going to kind of chat for a minute, and then we are going to go in and do a couple demonstrations, which we're going to discuss more. But first, let's start on vaginal health. And what do you offer here in your clinic that can help someone with that?
so there's a few different things we can do with vaginal health. We have the Sweetheart Shot, which would be sexual wellness type things, but we also do ozone therapy that can treat things like PCOS. It can treat endometriosis. It can treat even UTIs, things like that. So,
all right, let's get more specific. Tiff, what do you think we should focus on first?
Well, I know women have a lot of issues, especially as you start to get older, right? And our hormones dive. One in particular is UTIs. So I'm seeing a lot of women like struggling with that, never had them, and then they get to their later years and they're struggling with those. Or maybe they've struggled all along with those. So do you have any information on that?
we have a few different things that we try to approach with that. I'll let the medical director actually talk medical terms.
There's usually a couple of reasons why we get UTIs. If there is some infection that's going on, then antibiotics are appropriate. But other times it can be like the natural flora that we have, which is the natural bacteria that we normally have in our bodies. That can change over time. Dryness, particularly vaginal dryness, anatomy, things can drop, which we don't want them to drop. So all of those different things can alter and make urinary tract infections more frequent. So some of the things that we can do to improve that, of course, is see your medical doctor to make sure that there's nothing that needs to be taken care of, that there's nothing big that's concerning. Then after that, we look to see, is it something we can help with anatomy-wise? And we'll go over in a few moments about what Mella is. It's a machine that uses radio frequency to help with the strength of the overall vaginal floor down there. And it will help with the overall power of the body to heal itself. The secondary thing is we use ozone, which is oxygen-rich environment, which encourages healing as well. So there's a couple of things. And then we look at other treatment options, such as you mentioned hormone replacement therapy, which we can look at a whole hormone panel to see why is this occurring, because sometimes medical doctors will give you an antibiotic and then send you on your way. And it can be more that you're getting that vaginal dryness or something that's bothering you. So we look at the whole picture and do an integrated approach.
I love that.
That's
great.
incredible.
Yeah, I think there's so many women suffering and they just suffer through it and they don't seek the help. Or maybe they don't know about it. So that's great info.
Or they're told that it's normal, it's fine with aging, and suck it up.
No,
your mom went through it, you're fine.
Yeah, I don't want to. I want to be like healthy and have a good like sex life and all of those things.
Enjoying the journey the whole way.
Yes.
There you go.
Absolutely.
So what other, I know you mentioned in a previous discussion we had the Sweetheart Shot. The Sweetheart. Can you elaborate? Tell us a little more about that.
Okay. It has many different names. But there is a certain area on women that is just as sensitive as it is on men. We're not
What area is that?
It's okay. Well, there's a lot of areas, Of course, we all know about clitoral area. This is actually below. And below that area, up inside the woman, there is as much of erectile tissue as it is on a man.
Oh, okay.
I know, surprising. Yeah. And so what we do is we use the body's ability to heal that area. We use the own body's platelet-rich plasma, which is your blood. We spin it down and we obtain those stem cells, those healthy healing organisms in there, and we inject it in that area. So it's just inside the vaginal wall. Okay. It's not crazy uncomfortable. Of course, nobody loves to be poked down there.
No.
Well, not that kind.
Unintended.
So we're talking about a needle.
Okay.
Nobody wants to go down there with a needle. Yeah. So we use a very small needle. And we inject your own platelet-rich plasma in that area, and that regenerates and heals. We've heard of PRP facials. We've heard of PRP for joints.
And do you offer that there?
Oh, absolutely.
Okay, great. So they offer
absolutely.
Okay, but back to
back to the vagina.
Okay.
Back to the topic of discussion. So absolutely, if it works to rejuvenate this area, what else can we rejuvenate?
And does it tighten it?
Exactly.
Okay.
It's exactly what it does. It increases the stimulation, so it improves your overall ability to have an orgasm. And your sensation.
From a G-spot orgasm as opposed to just a clitoral orgasm.
We gotta get into that.
So we're not even by the clitoral area. Yes. We're down inside where it's even a more powerful orgasm, right?
Yes. Okay.
And so it's down inside that actually stimulates that area, and it rejuvenates that area. It strengthens that area. As we talked about the urinary tract, it's all neighborhood, right? Yes. Because they're all so close, we need to work on that area, and it helps with that urinary tract as well. So
great.
We're improving two areas with one, right?
Oh, see, perfect. Okay. And we'll talk about this maybe more here in a little bit, everyone. But okay, so we have a lot to discuss. I want to quickly move into ED. Okay, so we have some things here that I'm staring at.
I know.
And
I know what they are.
We don't know, but can you talk to us?
You know what they are.
Let's tell the viewers some statistics
Okay.
on ED and different ways that you can help here.
Okay. So a vast majority of men have erectile dysfunction in one form or the other. Either that they do not have the strength to maintain and obtain an orgasm, or they peter out and it just they aren't able to finish, or that they have a medical reason why. It's not always in their minds. Like sometimes they're fearful of thinking. Sometimes there's very much a medical reason. So again, we're using PRP, the magic word of the day, to help heal that area. So we inject PRP with a small needle along the penile shaft. So along the length of the penis on either side. There's a spongy type of tissue underneath, and that sponge just fills up with normally blood, but now we're using PRP. So that regenerative power of PRP that we get here, and for the ladies down there,
wow.
Exactly. So what does that help? Just like with women, it helps with both what we call angiogenesis, or the blood supplies. So we know that orgasm and general health and elasticity, lubrication, all of that is through blood supply. And it helps with the nervous system too, because it's healing all those tiny little nerves along the penile shaft. So those two things help with the overall function.
And it helps with sensitivity.
Absolutely. So sensitivity and blood supplies. So that engorgement process is more fluid, that it works more effectively. And because it's an entire system, we want to work on just more than just the PRP. So as she lovingly is holding, we have
There is an Austin Power reference here.
One Swedish-made penis enlarger pump.
That's not mine.
This is a penile stretcher. There's a lot on the market. This is one that's actually developed locally, and it helps with the ligaments of the penis, because you think that the penis has all of the attachments along the abdominal wall.
Yeah.
Just like ligaments in your muscle groups and your tendons, we've got to work on strengthening and stretching those. And so the gentleman will put their penile head there, and then they'll attach it and then
It doesn't pinch. It just holds it.
It doesn't pinch. No, and you have to think that it's spongy, right?
It doesn't hurt, men.
This is not when they're erect, right? This is when they're flaccid, right? So imagine with a flaccid area, and then it stretches open, and it holds open for a certain amount of time. There's a whole protocol. And so it helps them stretch, just like a yoga for the penis.
A workout for the penis.
Yes.
Physical therapy.
So what does that help to stretch it?
Because it helps just like you're stretching muscle groups in yoga.
Okay.
Okay, that seems very
Like the fascia. Exactly.
Oh,
So
yeah.
we're working on the health of the area. We're working on more than just...
So they do the shots as well as this.
They do this. This is what we refer to
Okay.
this as physical therapy, because it's it's stretching those ligaments.
Interesting.
I would have never known.
I know, right?
Yeah.
And then the second part.
And this is what it looks like. This is a vacuum. And the gentleman will also use this because that increases the blood supply to that area.
Yeah, that makes sense.
So we work with the ligaments and the blood supply.
Yes. And how often do they do this?
This is a daily activity.
Oh.
The physical therapy.
So this is physical therapy, just
the
like you would
shots
go.
be once a month.
Exactly. So this is done in the privacy of your own home.
Yes.
Of course.
And then, of course, there's vitamins, nitric oxide that helps with building of the blood supply in that area too. It helps with the new blood supply in that area.
So this is homework.
This is
This
homework.
is the physical
Right.
therapy.
And how often do they come back for the shot?
Excellent question.
Once a
One
month?
time a month for 6 months.
Okay.
And then depending on how they feel, they can need possibly a maintenance shot
okay.
6 months later, 3 months later, just depends. Everybody's a little bit different. But the cool thing is then this leads from not just ED to male enhancement. So because you are stretching it and you are giving it that healing process, in all of the studies and all of the people that have done this, they're 100% experience growth. And there are 0 side effects because it's your own body chemistry. So you can get up to 2 inches in girth and up to 2 inches in length in an erection. There are not before and after pictures for that.
Men getting up in the night needing to urinate. Is
Right.
this what helps with that?
No, well, in a way, but not. We'll be going over Mella in a
Okay,
moment.
that's something
Yeah,
we'll do.
that's the radio frequency machine that we will also show, because we want to work on more than just this for gentlemen and females too.
Okay,
There's
good.
so much to learn.
I want to talk about females again. Let's go back to a lot of females cannot orgasm without clitoral stimulation. Like, as in, it was like 70%
Yes.
of females.
That's
So
a big number.
it is. So
That's sad.
If you are young and you or even our age, and for some reason you can't have a vaginal orgasm, right?
Mhm.
You need that extra stimulation. Some people just have never experienced it, right?
Yeah.
Absolutely.
Yes,
It's something we just don't talk about as women. And
Yes.
you hear women a lot of the time say, I think I had one. Well, if you
Oh,
think you,
that's-
no,
If
you
think
haven't.
You,
You would know.
Yes.
Yeah.
You
So
know if you
it's
do or
something
if you
that's just such a hush topic, and it's something we should so be talking about.
Absolutely.
So I want to talk about that briefly. Okay. Do you have anything here that can help with that? That can help with vaginal orgasms beyond what we've talked about?
Well, the sweetheart shot would do that. That is
Okay, the sweetheart
kind
shot.
of the point,
Okay.
because it will not only increase tightness, but it will also add lubrication and encourage healing in that space. So then
Okay.
it does make it easier to access the G-spot.
Awesome.
And then with
Okay.
the Mella as well. Those are all the things that we have that would be helpful. And the Mella for a female, there's multiple things it can do, but it is the equivalent of 12,000 Kegel exercises in 28 minutes, and it contracts the muscle for you. So you just sit there and it doesn't hurt. It's just interesting. The only way I could ever explain that is interesting.
So yeah, we just want to help all of you if you're experiencing anything, because are we allowed to say that word?
Yes,
Pleasure.
Pleasure.
Yeah, we all want to experience pleasure in our lives. Yeah,
It's mental health. It releases endorphins. It's all of the happy things that we need in our lives.
Exactly. Okay, well, let's go.
All right.
Go see a few things, okay?
All right.
Okay.
Let's do this.
What do we have here, ladies?
All right, Tiffany, we'll have you
Okay,
have a
just
seat
sit.
in the throne.
Okay. This looks special.
This is called the Mella.
Make sure you place yourself right.
Yeah, what do I need to do?
I will let you know in just a moment. So the Mella is, again, it treats urinary incontinence. It's a pelvic floor strengthener.
Okay.
So this works for men and women.
Okay.
It works on radio frequency, so it'll
Okay.
contract the muscle for you. For females, it contracts your muscle 12,000 times in 28 minutes.
Wow. That's
So
awesome.
instead of doing Kegel exercises, this will do it for you,
Okay.
and
And
you just
so
get to sit there.
This
so.
is good for all women, but like especially women that maybe have had a baby
Mhm.
and like the tightening.
Absolutely.
If
So
they have
between these two pieces of
Okay.
equipment, we have the Emsculpt and Mella. They actually can treat diastasis recti,
wow.
which women are told the only option for that is surgery,
Yes.
where you get the separation
Yes.
from children.
Wow.
This will actually close the separation
So
and the
your-
gap. So it
your
will.
abdominal wall.
Yes,
Oh,
because
I didn't know
the
this.
Emsculpt will actually, that is the equivalent of 20,000 crunches.
Okay.
And it contracts the muscles for you
Wow.
20,000 times. And so it builds muscle, tightens skin, hits the subcutaneous layer of fat, and also breaks up lactic acid. So these help with soreness. There's so many things that these two pieces of equipment do, but it is very, very good for men and women. And then for men, it does about 50%.
So approximately 50% of the men that use this equipment find that they don't have to get up as often in the night to urinate, which is amazing because for men, that fractured sleep actually really contributes to their overall health. So if we can keep them sleeping, that is very beneficial. In addition, approximately 40% of the men find that they're able to maintain their erection throughout intercourse, and so they are able to orgasm because of this pelvic floor strengthening that it does. So we don't talk enough about the strength and the power within our pelvic floor. We always feel it when we sneeze.
Yes.
We always feel it when we cough. But until you've got wet pants, do you realize how powerful your pelvic floor can be?
Oh, wow.
How many treatments would a man or female need?
It would kind of depend on what the specific problem is. So
Okay.
we always recommend a minimum of a series of 4.
Okay.
Once a week for 4 weeks.
Yeah, that's
You
easy.
can do up to every 5 days, but no sooner than 5 days
Okay.
apart. So,
Wow.
but typically you'd see the results with this, and for women who've had babies, you cough, sneeze, laugh too
Okay.
hard, and you pee a little,
Yeah.
or you jump on a trampoline, you pee a little. This
Yeah.
in one treatment, you'll notice a difference.
I do that.
So
You do?
I can't jump on the trampoline.
No jumping.
without going to the bathroom.
I can now because of this.
Not that I'm jumping on the trampoline all the time,
Yes.
but yes.
So I remember
This
this
is
from
incredible.
workout class. 'Cause I've had all C-sections, but I'd go to do
jumping jacks.
jumping jacks.
Yes.
Half the women
Jump
would leave.
rope.
They leave
Yes.
because they're like, I gotta go pee right now.
Yes.
And I'm like, what are you guys doing? Like, because I don't struggle with that, but I know
I
a huge majority of women
Now
do.
they've come out with all these new panties for women that hide
Just-
like
oh,
the
yeah,
absorption,
yes.
but I think addressing the
it's a
actual
Band-Aid.
problem is a much better
Oh,
solution,
100%.
and that there is
Yes.
a non-surgical, easy, comfortable way to
Oh, yeah.
Oh my
relieve
gosh.
yourself of those issues versus
Yeah.
just having to deal with them.
Piggybacking on the other machine that you said helps diastasis.
Mm-hmm.
So my last baby was 9.5 pounds.
Oh,
And so Liam was.
He was?
Yes. So if you can imagine, I'm not all that big.
Yeah.
Yeah, like I was ripped open. So
Mhm.
I did have to get mine sewn together,
Mhm.
and he gave me a hernia.
Uh-huh.
Oh.
So
This
does
will
this
actually-
help with
yes.
hernia repair?
Oh, yeah.
Absolutely.
Because it helps
This will
heal
save
that abdominal
people.
wall.
Yeah.
This will literally save people.
No, it has. One of my good friends has done it, and she had the full cone of 4
Yes.
finger separation,
Yes,
and
that's
in
what I
2
had.
months it completely closed. Her 2-inch gap completely closed, and the cone
Wow.
is gone.
Wow.
Even her 10-year-old is like, "Mommy, what happened to your tummy? It's gone."
Oh.
So it's helped her
Yeah.
physically. It's helped her self-esteem. It's
Oh,
just
gosh.
helped every bit of her
Emotionally.
health.
Yeah.
And because
this
she
is
was
amazing.
she'd already given up that she wasn't going to have a tummy tuck or have the surgery.
Yeah.
And so she was just going to live with this for the rest of her life. But
Yeah.
this in a 2-month time frame. And then she just comes about once a month now and does a maintenance treatment,
Okay.
more because she says it helps her have no back pain.
Wow.
It helps her have no
Of
joint
course.
pain because
Of
of the
course.
lactic acid. So
Okay. Oh my goodness.
Awesome.
Yeah.
I'm excited. All right,
yeah,
let's
treats
see.
on my radar screen.
Well,
So
never
light
done
it
this
up.
before.
with the wands, it's a little easier because you can actually see the muscles contracting. This you can't see, but you get to see
So it's like
the
a TENS
reaction.
unit.
Like,
Very
I mean,
similar to a TENS
Very
unit.
similar
In the
concept,
same idea,
but
yeah, we're stimulating muscle groups from an electrical standpoint, radio frequency standpoint. So yes,
Okay.
so we won't see it, but we'll probably see her facial expressions. This
Yeah.
treatment, you remain fully clothed,
Yeah.
and you come in and you can sit and read and have quiet time for 30 minutes.
Read.
And
I don't know what that's like.
Right.
Okay. We're running company.
Well,
Tell them over here.
Yeah.
Because it is radio frequency, you can't have your phone. So.
Oh yeah, that's great.
Yeah. we do
Oh,
have a
yes.
television if you need to be entertained for those few
Oh,
minutes, but
So do I just shock her or do I ease
Yeah.
her
Wait,
in?
I'm getting shocked.
no, there's no shock.
Shocker.
There is no shocking.
Oh my. Oh.
There's some
So
sound.
basically you want to
Okay.
maneuver yourself to where you're not right on the anus and not right on the vagina, but that little piece in between, that little spot.
I think
Maneuver.
I'm there.
Sometimes
Okay.
you have to
Yeah.
kind of wiggle in, move thighs around, get right in there.
Ew.
That
you're on the
sound
pelvic
is
floor.
normal.
The sound is very normal.
You feel it?
Yeah. It's kind of like pins and needles.
Like tingly,
Tingly. Yeah. It
Okay.
doesn't hurt. It's not painful.
not
Oh,
unpleasant.
As you can hear, there's a series of
Okay.
different noises it makes and
Yeah.
different clicking and
Just
different
different. Like
variations.
there's no pain. There's no pain. It's just a different sensation. So,
Some people very much enjoy it.
yeah.
Yeah?
Yeah. Yeah, it's good.
It's not bad.
Good?
No,
Yeah.
it's not bad.
But it's hard to explain, right?
Yeah, it is hard to explain.
Unless you're sitting
Yeah.
there, it's hard to really.
Like not what I expected at
Right.
all. Yeah. Kind of a little bit contracting without the pain. So it's like tight, but there's no pain.
Without doing Kegels, can you imagine tightening that area of your body just.
You can't do this.
Right.
You can't work out.
Those are
like
areas
this.
you cannot normally
Yes.
stimulate. You can't concentrate on that vaginal
Yeah.
floor and say, I can do this.
Yeah.
I got this.
This is like adding weights to Kegels.
Okay.
So like if you're
Without
doing,
the discomfort.
yes.
Okay.
Yeah.
Yeah.
Like it's making it a lot more intense.
Right.
So yeah. Wow.
And this does help with UTIs, you said?
Absolutely, because
Wow.
this works on that urinary tract health and that pelvic floor health we talked about.
Yep.
That architecture, we're strengthening all that's through there. So if you think over time having babies and running and jumping and all the things we do as women and weight loss and weight gain, things get a little floppy
100%.
and they
yeah.
start tipping like our trees or our fences in our backyard and such. So what that does is it helps rectify and bring those ligaments and the muscles all into strength again.
Yeah.
Incredible.
So if you make that stronger,
Yes.
and then in the same token, because your pelvic floor is now healthy,
Mm-hmm.
that sexual health improves as well. So the sensation down in that pelvic floor as you're being stimulated, then it's able to respond and contract and relax and enjoy the experience more because everything's more powerful down there.
This would have been great to have in
Tightens
between
everything up.
Yes.
I didn't
Oh, for
get
sure.
that. I'm done, but
Yeah,
that
for sure.
This would have been great. Like
Exactly, because
Yeah.
it strengthens up that
Yeah.
area that has already, because of all of the hormones we go through during pregnancy, it relaxes, and then sometimes it can get torn and stretched.
yeah.
So that strengthen those right back up.
What's the difference in that? Is that just
It's getting different levels
Okay.
of the muscle groups.
Okay.
So just like you would change the way you're doing a muscle
Okay.
stretching
Like
at the
arm
gym.
days, there's 3
Yes.
different things you do on. This is hitting all
Yeah.
the different muscle groups with the different noises.
okay? Love it.
Cool.
How many
Okay.
different muscles are down there?
It's a web of muscles,
Okay.
so we never have, just like our abdominal muscles, we have muscles that go this way, we have
Yeah.
muscles that go this way. Same as there, they are interwoven because then that allows us to have the dynamic motions and bodily functions that we do as humans, as women.
Yeah.
It has to have this beautiful web. This
Right.
intricate-
Probably a lot.
Yes.
Lots and lots.
Yeah, it's like you can't just work your biceps.
Right, you
Like,
got
right?
biceps,
Yeah,
you got
there's-
triceps, you got, oh, and there you go again. Here we go.
Perfect.
Okay, very
Worked
good.
out today.
I know, right?
How long is this?
28 minutes.
28 minutes. Okay.
Yeah, remember, in every 5 days.
Yeah.
No
But,
sooner.
yeah, we typically recommend a protocol once a week.
There's no
Stay the same day week,
activity
but-
restrictions before or after, there's,
Other than heat, we don't want to be heated before. So we do have an infrared sauna, and people will do these things and then do sauna, but you can't have your body
Most
heated up
people
prior to
don't.
radio frequency.
most
Okay.
people don't do that though. They'll come in hot.
Cool.
Okay. Just
Ah.
demonstrate it.
She's like, don't make me.
I'm good with
If I'm
endorphins.
doing this.
I know. I'm good
You're
with
doing
endorphin
that.
rush pain, but not like I'm sitting there and I know. Oh!
I'm sorry, I had to. As a new patient, I typically would not do that to you. I say typically.
Wait, is it good or bad?
No, it's
It's
fine.
unpleasant. It's
Turn it down. Turn it. That was exhausting.
I guess it's not a bad thing your boyfriend's out of town for 2 days.
Oh.
All right, now we'll move on to the last area, which we will actually demonstrate what the process is to do a sweetheart shot, which is the PRP, platelet-rich plasma, and then we will inject one of the ladies, but you won't get to see that part. So we didn't bore you guys with the details on drawing the blood and then spinning the blood, but this is what happens when you spin the blood, and then we just pull the plasma off of the top of that, and we call this liquid gold because this is your own body chemistry promoting healing and all of the things to help your body rejuvenate.
And this
All
is
the-
what procedure are we doing on me right now?
This is called the sweetheart shot.
Okay, the sweetheart shot. Okay, and
So, as you remember, we're going to use the body to heal itself. We inject near that vaginal opening, and we've already applied some numbing medicine, some lidocaine. So this is even less discomfort than if you get any facial injections or dental. This hurts less. Okay. This hurts less than a pap smear.
okay.
Like, pap smears don't feel fun.
yeah. No.
This is, other than it being uncomfortable because I'm in your hood, other than that portion, it's really not that uncomfortable. We try to make it as easy, as discomforting as, as we can.
Okay. And people you suggest do this a series of how many?
Typically, we recommend a series of 3 for women.
And that's once a month?
Yes, and then we could go from there because it's a little different men versus women, and so for women, you may have enough, or at that point, then we would assess how you feel, if you feel like you need more.
Say you do a series of 3, then you come in like once a year for maintenance, or
Every person's going to be a little different, to be honest. So it just depends on you, on if you notice it was doing well and then it's not doing as well, then we do a maintenance shot, and we could do another series of 3. It just depends on your body.
So as far as this goes, there's very little risk factors because this is your own blood. So there's no allergic response. And I have never had, even though we're using a needle, I've never had an infection ever because it's your own body healing itself. So the risk factors are very, very low. And with this, there's no restrictions after, other than...
let's be specific.
very specific.
sexual restrictions.
There is no sexual restrictions after.
Working
You can
out.
go work out, just whatever you tolerate. And most patients just feel like it's, they just go on with their day. There's no discomfort or anything.
So I will feel a difference, or like
You may
a
feel it-
person's partner will feel the
You will
difference?
feel a difference within the first couple of weeks.
Oh, so the partner feels a difference too.
Right. If things are
tightening,
tighter,
more lubrication,
yes.
more sensitivity.
All of the things we're working on are benefits for the partner as well.
What do I do?
You're just
Relax.
gonna
Breathe.
relax, and I'll do my job, and you don't worry about anything. Okay?
Okay, hold on.
You're good. I will tell you before.
Are you sure I'm not?
Do you want to talk
wanna
about? Do you want to
If
talk
you
about
need
going to
me
Greece?
stop, I will stop. Okay? You just tell me. Okay?
You're good.
Okay, got it.
Okay, hold on.
Mine
Do you need your other hand held?
That's like Botox. I gotta get a boob.
Yeah.
This is less than Botox.
Yeah. You want to count now?
Okay. No.
No countdown?
Okay.
Okay.
Should I relax?
Yeah.
Yeah. You should be relaxed. Okay.
I'm freaking out. Okay, no, I'm okay. I'm okay.
You got
No,
it.
I'm
There's a
okay.
poke.
I'm okay, right?
Good.
You're so
Halfway
pretty.
done. Halfway done. That's nothing.
Okay. Okay.
Does it hurt?
Yeah,
A little bit?
Okay, there's some fullness here.
okay, it's okay.
You're
Oh, I got it.
almost there.
We're almost done.
Okay, I got it.
You got it.
Ooh, okay.
Good job. It's almost over.
Yeah, I got it. No, everyone, it's okay, viewers. It's not bad at all.
And we are done.
Not
She's
bad at
selling
all.
that well.
The needle is out.
Oh, yeah.
There you go.
Oh, woo!
Yes.
We're done.
That's it.
That's it.
Okay.
No, was it really that bad?
No, it was okay. There was just that one
It's
sting.
some pressure sting.
Okay.
Yeah, just
It's
that
the
one,
idea.
that one moment.
Okay.
But other than that, no, that was fine.
Yeah, you did great.
Holy
Good
cow,
job.
that was- have you done this before?
No, I mean we're really close, so I just haven't
It's
gotten
trickier
close
when it's
enough
your-
to like
Okay.
be all up in there and then have to look at her every day.
Yeah.
I'm getting there.
Yeah, right? It's fine. It's fine.
What
So
to
I feel
expect
weird
here.
because it's just numb.
Yes.
That's
It's like
what
having
that
a
feeling
numb.
is I'm just numb.
Yeah, there's an lidocaine. It's like when you have a
How
numb
long
face and you're trying to smile.
Okay, that's what that is.
Yeah.
And it's 4 hours.
Yeah, it'll be about 4 hours and then it'll resolve on its own, and
Okay.
you shouldn't have any discomfort or anything.
Honestly, the 4 hours of feeling it or
Numbness?
the numbness, it probably won't last 4 hours.
Yeah.
I mean, it could be up to 4 hours, but it'll probably be worn off in
You did great.
20 minutes.
Yeah, thanks. That was stressful.
That's like a roller coaster, right?
Thanks so much for joining us today. We have learned so much.
Yes, we have.
I want to come back. This was great.
Yes, and we are very excited. Our company, they sell our lip plumper and our lash serum here, as well as, of course, the other great
the
products.
goodies.
But come in and see them. We actually have a special offering for
Yes.
you. So what is that, Kim?
If you just mention Bellamarque, you get $100 off any service or any treatment or towards anything. And if you do want to get a P-Lung or a Sweetheart shot, we'll give you $500 off if you mention.
Oh, geez.
That's
$500.
Oh,
You guys
gee.
jumped-
Oh.
Oh,
That's for the
Very
O.
fair.
There you go.
Okay, you guys, thank you so much for joining us. And it wouldn't surprise me if we come back here. So,
We'll be back, for
all
sure.
right, tune in, see all of the details below.